double cord technique for predictable retraction, impression and scanning. The new episode of BG Dental Tips is online. Stay tuned and you will see some tips and tricks related to this topic. Dear colleagues, today we will discuss a very interesting topic like retraction and double cord technique. And I would like to share with you some tips and tricks related to this approach. So first of all, in which case I use double cord technique. When we do preparations in aesthetic areas, so in most of them we do our preparations inside the sulcus or intraclavicular preparations because we don't want to get problems with aesthetic transitions. So when I do preps, I place my first retraction cord, small one let's say, and then I move margins inside the sulcus. Okay, so once I finish preparation, then I would like to see if all my margins equally exposed or not. If I can see all margins around, no problems with the gingiva, no bleeding, no hypertrophy of the gingiva, so we can just do impression or scan and that's easy. But in some deep cases like this one, by the way, very compromised, very difficult cases with some kind of recessions, abfractions and so on, it's another story about the treatment planning for these kind of cases. But these preps are deep, and after you finish your preparations, probably you will get some bleeding and some areas, a lot of actually zones and areas will be covered with the gingiva. Okay, so your finish lines will be hidden by the gingiva. So to make a good impression or to make a good scan, in such cases we will have to use a second retraction cord. Like in here, you can see the gingiva covers the finish line, so we will have to really expose it. Otherwise, your dental technician will be not able to see it, and then you will have problems with the fit of the restoration and so on. So we place the second retraction cord, and you can imagine how difficult it is to place retraction cord in such cases, even the first one. So the trick is the retraction cord size has to be chosen properly. It has to be as thin as the half of the patient's sulcus. Okay, so if sulcus is 1 millimeter, ideally retraction cord has to be 0.5 millimeters. Okay, and then another thing is that we have to, that's important, we have to use a special instrument for that, for the cord packing. It has to be thin enough to be able to bring the retraction cord without extra forces apically. So in this case we can use flat plastic instrument, a thin one for composites, or very thin cord packers, which will give you possibility to insert retraction cord into the sulcus without, let's say, extra stress. I would like just to show you some numbers, some thicknesses of the retraction cord packers. You can see here 0.15 very thin, the one that I used on the video 0.3, and the 0.5 which is too thick, to be honest, because if you use these thick cord packers you will definitely have to apply apical forces and then you will get some problems with the gingiva. So my favorite is the thinnest one that I can use in 80% of my cases, like thin biotype, normal biotype, and the depth of the sulcus 1.5 millimeters. If sulcus is deeper, then I can go with the D03 millimeters cord packer, which will be more efficient and predictable in such cases. Just to mention that we have designed these cord packers. They are available on our online store. You can see the link. You can go there, BeloGrad.com shop, and you can choose any size of the cord packer that is very efficient for your daily practice. Like the thinnest one is type 1, 0.15 millimeters, and 0.3 is type 2, and you will definitely enjoy this kind of instruments in your practice for sure. So if you have bleeding, okay, if we have bleeding, what we do, we can use some hemostatic gel. For example, you can soak your second cord with a hemostatic gel, or you can apply hemostatic gel directly to the area of bleeding. Like in this case, you see that I placed the gel. It was Ultradent Viscostat Clear. Then I use a second retraction cord, in this case, which is one size bigger than the first one. We have to pack it inside the sulcus because this second retraction cord actually gives us a lateral retraction, right? So it has to be packed to be able to move, to shift gingiva more laterally. Okay, so then we keep the second retraction cord inside the sulcus for 5-6 minutes. 5-6 minutes. Okay, then after that, what you do, you rinse everything. Okay, and then you will have to remove the second retraction cord. Okay, you have to do this procedure relatively fast, because once you remove the second retraction cord, so you have exposure of your finish lines, but this situation will be not stable in time. In 1-2 minutes maximum, the gingiva starts to collapse. So you have 2 minutes to do your final, impression or scan. In this case, you can see in a digital impression, like a continuous arch technique. So I start to scan from one side, and without interruption I go to another side. If we can continue that way, you can just grab another part of the teeth to your intraoral scanner, and everything has to be dry, everything has to be visible, exposed, so you will have a nice scan and nice impression, and your dental technician will not argue with you. So in one of our live Q&A session on YouTube channel, there were some questions about good impressions or good scannings, tips and tricks. So the tips and trick is to expose your margin, okay, to provide a good retraction. If you have deep preps, to have everything dry, everything clear, and then you will be able to make a very good scan or impression. Okay, hope this video was useful. I would like to ask you one more time, don't forget to put likes, to share this video with colleagues, to follow us for more, because we are planning to do more and more projects, more episodes, more tips and tricks. So stay tuned, and may the dental force be with you.